I want you to go ahead and take a nice deep breath. Don't worry, I'll wait a moment. Great. Now that you've taken that deep breath, let's take a moment and let's think about what you felt. Did you notice that your jaw was clenched? Did you feel your shoulders rise up to your ears? Or did you notice that your stomach actually sucked in? If you noticed any of these things, then you're not breathing properly. And if you're not breathing properly, we can typically assume that your pelvic floor is not functioning at an optimal level. Now that you know how you're breathing, let's do a quick anatomy lesson. That way it'll make better sense to you as to how your pelvic floor is directly influenced. So every time you take a deep breath in, you'd expect for your diaphragm to drop down, allowing for the lungs to be able to expand. As your diaphragm drops down, you want for your pelvic floor muscles to also drop down. Your pelvic floor acts as a bowl. If you look on the bottom, you can tell that it kind of domes out. Looking from the top, you can tell how it kind of sinks in, acting as a bowl that is holding your internal pelvic organs. As this pelvic floor drops down, you want to make sure that you're getting the best expansion that you possibly can. The only way to do that is to be able to utilize your diaphragm. So everything that you noticed before that you were doing with breathing, that's indication that you're not using your diaphragm. So now that you know exactly what should happen, let's work on fixing it so that way you can do it too. We're going to break breathing up into different steps to help make it easier. That way you're able to later replicate it. First, let's start up top with your jaw. If you're someone who likes to clench your jaw, know that you're not getting the best expansion because you're actually using more of the muscles in your shoulders and necks when you go to breathe. So step one, take your tongue and place it at the roof of your mouth, just slightly behind your top teeth. If you're able to make a noise, then you know you're in the right spot. As you do that, you want to keep your back teeth separated so your teeth should not touch at all. After that you're ready to begin changing how you're breathing. Great, you've made it to step two. Step two, as you probably notice, every time you're sitting at your desk, you always end up with your shoulders up towards your ears or even rounded forward this way here. That position is a terrible position if you're trying to utilize your diaphragm and get the best expansion for your lungs. So, step two, sitting up tall, keep the shoulders nice and relaxed. Sounds easy, but it's something we always forget to do. Step three. Great. For step three, I want you to take one hand, place it on your chest. Your other hand, you're going to place right on top of your stomach. Now, as you take a deep breath in, and remember, don't forget step one or two. So don't let your jaw clench together. Don't let those shoulders rise up. But now, taking that deep breath, you're going to allow for your chest to lightly rise and also for your stomach to push out into your hand. So as you inhale, things should move forward. As you exhale, you should feel everything drop back down. If you notice that when you inhale, you want to actually suck in, take a moment and focus first just on getting the belly to work properly. So focus on actually pushing your hands out with your breath and allowing for the hands to come back down. The more practice you give this, the better you'll get with the different activities. Now, all of these tips are for your relaxed breathing. For times when you're actually doing activities, we want for your shoulders to be able to kick in to help you with that run. However, if you're just relaxed and you're just focusing on just sitting, watching a movie, you shouldn't be using your shoulders to breathe. You shouldn't have your jaw clenched, and you definitely shouldn't be sucking in your abs trying to get a breath in. So let's now review steps 1, 2, and 3 and put them to work. Now we're going to take steps 1, 2, and 3 and combine them so that way you can get a better idea and also get some more feedback as to what your pelvic floor is doing as you're breathing. I'm sitting on a ball, but at home, you don't have to sit on a ball. You can either use a pillow folded in half or even a towel rolled up. You want to place the pillow or the towel directly in between your sit bones. That way, as you inhale and you feel everything expand, you can feel the pelvic floor actually dropping down into the ball, pillow, or towel, whatever you may have. So let's take it back to step 1. Do you remember? Step 1, let the jaw remain relaxed and keep it unclenched. Great. Step 2, keeping the shoulders down. And last but not least, step 3, you're going to gently allow for the tummy to expand forward and the chest to gently rise. Please remember that these breathing techniques are more so for when you're doing relaxed breathing. If you're exerting a good amount of energy, your breathing does change. Are you ready to practice? Great. So jaws unclenched, shoulders relaxed. You're going to place a hand on your chest and also on your stomach. And I want you to go ahead and take a nice deep breath in. Now exhale. Did you feel your pelvic floor move at all? Hopefully you felt it drop down, but if not, that's okay. This is something that takes a lot of time and a lot of practice in order to master. Once you're able to master this type of breathing, then we can move on to more complex breathing, something called 360 degrees breathing. With 360 breathing, we're able to get more movement for the ribs, which also allow for your lungs to expand even more. But first, let's master this together. Once you have this, then maybe I'll see you next time for 360 breathing.